All right, so my presentation is about dengue fever. Um, we'll be talking about one of the most widespread mosquito-borne diseases in the world. We'll look at its biological origins, history, public health response, and its ongoing relevance in today's world. So, the pathogen. So, dengue fever is caused by the dengue virus, a member of the Flaviviridae family. There are four distinct kind of serotypes, which all are in caps D, E, and V. So there's D, E, and V 1 through 4. And if you get infected with one of those serotypes, you get lifelong immunity to that type, but only temporary protection against the others. So this increases the risk of severe dengue with subsequent infections. Viruses do not have the same genus and species naming. However, in viral taxonomy, it has similar name with a genus of flavivirus and species of dengue virus. Um, so discovery. So the dengue virus was first isolated in the 1940s. This is largely thanks to the work of Dr. Albert Sabin, who is also known for developing the oral polio vaccine. His research during World War II led to a better understanding of the virus and its transmission, laying groundwork for future vaccine development. So in the 40s, he isolated outbreaks from soldiers in Southeast Asia. He kind of was the first one to really discover the virus and understand how it was transmitted via mosquito. And he used monkeys and mice to test infectivity and symptoms of the virus after filtering out bacteria. So he was able to really isolate it and determine if that it was a virus and not a bacterium. Transmission. So dengue is transmitted primarily through the bite of an infected Aedes mosquito. These mosquitoes are day biters and often live near humans in urban environments. After biting an infected person, the mosquito carries the virus and can transmit it to others for the rest of its life. So here's a example of the transmission life cycle. The mosquito bites an infected human. The mosquito becomes infected, and then it bites a susceptible human, and the human becomes infected. Here we have vectors, the primary vectors and the secondary vectors. There's different types of mosquitoes. The primary is the one that causes most infections. They're the aggressive biters in the early morning and late afternoon, and the secondary vectors are not as aggressive, but they still can be seen in cooler climates in rural and suburban areas. Diagnosis and treatment. Diagnosis is confirmed through blood tests that detect the virus, its antigens, or the body's immune response. There's currently no specific antiviral treatment for dengue. Instead, care focuses on managing symptoms like hydration and rest, and acetaminophen for pain. It's crucial to avoid NSAIDs and aspirin due to the risk of bleeding. You'll see soon that their bleeding is a symptom of dengue fever. So yeah, like I said, people with dengue usually see things like high fever, severe headache, pain behind the eyes, severe muscle and joint pain. Later you'll find out that this severe muscle and joint pain is why people call it breakbone fever. Nausea, vomiting, skin rash, fatigue, mild bleeding. You get more nosebleeds, gum bleeding, and easy bruising. So symptoms usually appear 4 to 10 days after the infection and include all these things. In severe cases known as dengue hemorrhagic fever, symptoms escalate to internal bleeding, low platelet count, and even organ failure. So it can progress to severe dengue and cause potential death. So for prevention and control, preventing dengue centers around controlling mosquito populations and avoiding bites. Since we don't have a secure treatment yet, it's all about prevention. Treatment we are working on, but there's no official vaccination that is 100% accurate yet. So this prevention includes eliminating standing water, using insect repellents, wearing long sleeved clothing, and installing window screens or nets to prevent mosquitoes from entering the home. Community-based efforts and public education campaigns are also key in reducing these outbreaks. So, like I said, preventing mosquito bites is how we control dengue. It's also advised to wear personal protection, protective clothing, using the bug repellents, staying indoors during peak mosquito hours. Since mosquitoes like to breed in stagnant water, it's important to be wary of where you're hanging out if you're near stagnant water in high season. There is a dengue vaccine. It is recommended for individuals who have had a previous dengue infection. It can help protect further infection if you've already had it, but it's still not 100% preventative or foolproof. So dengue fever is not considered a zoonotic disease. It usually follows, since it follows this human mosquito cycle, it's not really a natural spread between animals and humans. So the earliest descriptions of what may have been dengue-like outbreaks appear in Chinese medical texts from the Jin dynasty. This dates back to around 265 to 420 AD, and these writings refer to a water poison illness likely linked to mosquito exposure near water sources. These outbreaks really impacted urban populations, including military personnel, civilians, and ports and cities. So port cities were definitely the hot spots because of trade, and waterborne illnesses can come really easily from ports. Public health responses at this time. So government efforts was pretty limited. We didn't know much about germ theory at this point. Miasma theory was still the main leading reasoning for any diseases in the time. So medical understanding was limited. Public health responses were rooted in traditional beliefs focusing on environmental balance and spiritual causes. While there was no clear concept of virus or vector, some communities took practical steps like draining stagnant water to avoid swampy areas. So there was also a portion of the general public that believed the disease was divine punishment. So we did have religious groups at the time that held prayer gatherings, processions, and fasts to seek divine help. Miasma theory was still the main consideration, that there was bad air and filth, not that it came from a mosquito. We didn't really know that diseases could come from animals yet. We just thought it was bad air. Quarantine measures were taken in place. If there was a ship that was coming into port that was known to be infected, they would quarantine the ship for weeks. This will later have consequences that we'll talk about in the future. So, historical impact. So dengue has influenced human history in subtle but significant ways. Though it didn't cause widespread pandemics like smallpox or the plague, it disrupted military campaigns, trade, and local economies, especially in tropical regions where outbreaks were frequently occurred. Dengue fever was also at the time of yellow fever, and the two of them were kind of hitting major ports at the same time. So a lot of the researchers that researched yellow fever also were taking part in dengue fever as well. We had the International Health Cooperation, as well as sanitary conferences in the 1800s. Benjamin Rush had a big part in this as well. This started to bring the idea that government should actively intervene in public health rather than leave it to private charities or religious groups. So the government finally started realizing that maybe these diseases that are impacting not just human health, but also human economics, society, government systems, people were losing money because so many people were getting sick and couldn't work. Um, so, like I said before, ships would be quarantined because of maybe sick workers. So preventing them from coming onto mainland did help save mainland civilians, but the cargo that they had on the ships would expire. So businesses started to develop insurance contracts, factoring in epidemics and the goods that it would ruin in the process. Societal impact. So, Dengue's societal impact includes strain on healthcare systems and fear during peak mosquito seasons. In heavily affected regions, it affects daily life and mobility, especially for vulnerable populations like children and the elderly. Poor communities living in unsanitary conditions were also accused of breeding pestilence. It was a very one sided argument. At this time in society, the wealthy and the rich kind of took over and left the poor and lower class with nothing but higher exposure rates to mosquitoes. It's also more likely that these communities are living near stagnant water, which are breeding grounds, so exposes them even more. Behaviors did shift after the plague. People started to drain water containers and screen windows, but this was only really seen with the higher class that could afford it. Lower class families often didn't have money to protect themselves or their houses, so they got the worst of the exposure rates. There were certain cities that upgraded drainage and garbage disposal and water management because these were like really big hot spots for mosquitoes. So Havana, Rio de Janeiro, and New Orleans took big parts in making sure that their people were okay. Then we started seeing mosquito control campaigns in the early 1900s. We started looking at vector control units because of the lessons we had learned in the previous outbreaks. We once again going back to the let's try to prevent mosquitoes from biting us in the first place so we can prevent the sickness from happening before it's too late. So the economic impact. So the economic toll of dengue is pretty substantial. Governments must allocate resources for mosquito control, hospitalization, and public education. In endemic areas, outbreaks led to reduced productivity, lost income, and a burden on healthcare infrastructure, especially during severe epidemics. So, it didn't completely eradicate or reset economies like other plague pandemics did. Ultimately, this is a really slow and long drawn out epidemic. So, unlike the bubonic plague, the economy stayed and it didn't totally disrupt the balance of all government and economy and society. The only issue was it still leaves this gap between the poor and the wealthy. So the poor communities were still hit much harder than the wealthy. They couldn't afford anything to protect their homes. So this is where we see the worst economic impact. If the dengue fever didn't kill enough people fast enough to collapse the systems, it just caused chronic harm and widened inequalities rather than redistribution of wealth. So classes stayed how they were. Gaps between the wealthy and the poor widened. The only people who were maybe hurt were wealthy farm owners in colonial times in areas that had enslaved workers who were getting sick constantly because they weren't protected. So, one significant person who helped during the dengue outbreaks was Major General William C. Gorgas. He was born in Alabama, and he was nicknamed the Mosquito Killer after leading a bunch of medical research in the 1910s. He served in Havana, Cuba. This is where dengue was prominent, one of the hotspot cities. He was more famously known for combating yellow fever. His work in vector control helped shape strategies that would later be applied to dengue prevention, especially in urban planning and sanitation. Later, he did such a good job preventing dengue and understanding how to drain water and install screens and enforcing more sanitary regulations with yellow fever and dengue. He was later put in charge of public health during the Panama Canal construction and started using lots of vector control. This showed that, stopping mosquitoes was just as important as treating sick people. If we can prevent it, it's even better than treating sickness. The primary source, Benjamin Rush, was a founding father and a physician, and he documented what may have been early cases of dengue in Philadelphia during the late 1700s. He provided some of the first clinical descriptions of the disease, calling it breakbone fever due to the intense joint and muscle pain patients experienced. So here in this picture, you can see the patient on the left in pain. We see these workers on the right trying to figure out maybe providing care for the patient, cutting wood for the fire, and all they could really do was sit and try to help, but since they had no idea kind of what was going on in this disease and how to treat it, it was mostly just make sure they were as comfortable as possible. But yeah, so this is a little bit more information about Benjamin Rush. Additionally, his detailed records helped distinguish dengue from other fevers of the time and underscored the need for careful observation in diagnosing emerging illnesses. While the exact virus wasn't known yet, Rush's work laid the groundwork for understanding dengue as a unique condition. So he was able to recognize that this fever was different from other fevers they had seen in the past, especially with this extreme joint pain. People were complaining about aches and pains so bad that they realized that this was a unique thing. A quote from Rush that I really like that describes the breakbone fever. He says, "The pains in the head, back, and limbs were so acute that they have been compared to the sensation produced by the rack. This disease seized whole families and whole streets at once, sparing neither age nor sex." So it really shows how dangerous and honestly just awful the disease was. The rack is a torture device. If you're comparing your pain to that of a rack, which will tear your limbs off your body, this obviously wasn't a fun thing to go through. So when we look into modern day relevance with current cases and everything, dengue fever still remains to be a pressing global health issue. We still get it today. And honestly, today, there's way too many cases that they're still not able to treat. We have about 400 million infections occur every year. In 2024 alone, countries like Brazil, Bangladesh, and the Philippines reported hundreds of thousands of cases. Urbanization, travel, and warmer temperatures continue to fuel the virus's spread across new regions. Climate change is one of the worst issues with mosquitoes. Mosquitoes are able to live in different areas now because the temperature is getting warmer, so it's able to inhabit even more countries than it did when it first emerged, back when miasma theory was still prevalent. Vaccines are being made, but they're not 100% effective yet. There's also a chance of hyperendemicity, where you could get multiple dengue strains circulating at once, because there is about 4 different types you can get. Lessons learned. So today we understand that fighting dengue requires a combination of science, policy, and community involvement. We've learned that early detection, vector control, public education, and equitable healthcare access are all crucial. The development of vaccines, while still limited, offers hope for future protection. So, worldwide cooperation, we've learned that you can't just let religious charities and private groups figure out what this disease is. It was one of the leading diseases that caused doctors and government leaders to say, maybe we should dedicate more time to researching this because so many people are getting sick. It also became more ecologically thought about how climate and water management are important. So we started looking at maybe how water can actually make us sick. It can teach us that illnesses are not just from bad air, they're from other sources like animals and unclean water. In summary, dengue fever is a complex disease with ancient roots and modern day relevance. From its viral structure and transmission to its historical, societal, and economic impacts, it challenges us to take a global and collaborative approach to health. Thank you for listening to this presentation. We have the annotated bibliography, different sources I use, including World Health Organization, some other articles discussing breakbone fever and historical accounts of Benjamin Rush and other important characters. Thank you.